Hey everyone, we've got another specimen today. This is number 621 in our collection, and we'll go ahead and start off with a quick teaser to kind of highlight the main feature of this heart that we'll be reviewing today. And here we've got a heart that actually does have a double aortic arch. And I will show you kind of a classic view looking down at the arch. And here you can see that, in fact, here is the ring formed by the double arch. So the trachea and the esophagus would, of course, down here. This is, in fact, the left arch here. And then this is the right arch here. And here is the left carotid, left subclavian, right carotid, right subclavian arteries arising from the double aortic arch. So once again, a double aortic arch. Here is the ascending aorta. Here's the left aortic arch. Here's the left carotid. Here's the left subclavian. We'll go ahead and let these fold down. And when we do that, we see behind it is in fact the right arch here. And the right arch gives off the right common carotid and the right subclavian artery. But now let's go ahead and just get ourselves oriented and take a look at the anatomy of the entire heart. The heart would have sat roughly in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior here, left over here, right over here. Now let's find the right atrial appendage, at least externally. And here we find that there is an appendage that's triangular, broad-based or pyramidal in shape. So let's go ahead and open up the heart there. And when we do that, we do find that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. Now, when we also look at this atrium, we do find the oval fossa here, and there appears to be a small communication or defect within the oval fossa itself. And then we find the mouth of the coronary sinus, and it is guarded by the Thebesian valve here. And then we do see the tendon of Totaro here. And we know that the tendon of Totaro, the mouth of the coronary sinus, and the right-sided atrioventricular junction forms the triangle of Koch. So here's the triangle, and at its apex is where we expect to find the atrioventricular node, so we would expect in this heart that the AV node would sit here. Now, when we look at the right-sided atrioventricular junction, we do find that it's guarded by a 3-leaflet atrioventricular valve. Here's 1 leaflet, here's 2 leaflets, here's 3 leaflets, and we do find that this valve has direct connections to the ventricular septum, all findings consistent with a morphologic tricuspid valve. When we look at the ventricle here, we find that it has coarse trabeculations. There is a septomarginal trabeculation here, aka a moderator band, all findings consistent with a morphologic right ventricle. And then here we find an outflow tract. It's all supported by muscle. There's no fibrous continuity here, consistent with a pulmonary valve. And it does appear to have 3 leaflets, 1, 2, 3. Unfortunately not opened up, and I don't want to open this up at the moment. But here's the pulmonary trunk, and we can see from the pulmonary trunk arises an arterial duct here. We'll sneak over to the posterior aspect of this heart now, and we'll find the second atrium. Oops. All right, there we go. Here's the posterior aspect of the heart. Here's the left atrial appendage. Here we find another atrium, and this one is smooth-walled, consistent with a morphologic left atrium. All the pectinate muscles are confined within the appendage itself, and here's the mouth of the appendage, so all consistent with a morphologic left atrium. Here we can see the horns of the oval fossa, and then we see the left-sided atrioventricular junction, which is guarded by a 2-leaflet atrioventricular valve. This valve does not have any direct connections to the ventricular septum, consistent with a morphologic mitral valve. Now, when we look at this ventricle, that mitral valve opens up into. It does have fine crisscross trabeculations, all consistent with a morphologic left ventricle. Then we get into the left ventricular outflow tract here. We find an arterial valve that has 3 leaflets, 1, 2, 3. And this valve does have fibrous continuity with the anterior leaflet of the mitral valve, all consistent with a morphologic aortic valve. And do note that the actual annulus of the mitral valve and the pulmonary valve, so both arterial valves, is not actually round or oval. It's actually crown-shaped or coronet in shape, as the half-circle fibrous valvular leaflets have these myocardial triangles interposed in between them. That's not to say that the basal ring, which is that round or oval annulus that we create clinically, isn't a helpful construct. It's just to say that it's not a true anatomic structure. And then here's the ascending aorta. But let's take a look again at the aortic arch, as that was our focus here. So let's get everything nicely aligned. So now we're looking from the anterior aspect again. And here is the pulmonary trunk right here. Here's the ascending aorta. And we find that there is an arterial duct coming off the pulmonary trunk. And then when we take a closer look at this aortic arch, we can see that there is in fact a ring here. And in this nice little circle is where we'd have had the trachea and the esophagus course through it. Here is the left aortic arch. Here's the right aortic arch. This is the left carotid. This is the left subclavian. Here's the right arch. This is the right carotid. This is the right subclavian. And then here's the descending aorta. So a vascular ring, a double aortic arch, as well as a small oval fossa interatrial communication.